Pressure ulcers, also known as pressure sores, bed sores, or decubitus ulcers, are injuries to the skin and underlying tissue that occur due to prolonged pressure on the skin. These ulcers typically develop in areas where the skin is in contact with a hard surface, particularly over bony prominences. They are most common in individuals who are immobile or have limited mobility, such as those confined to a bed or wheelchair. Causes pressure ulcers develop primarily due to the following factors. Pressure. Continuous pressure on the skin reduces blood flow to the area, leading to tissue damage. This is especially concerning in individuals who are unable to change positions frequently. Friction. When the skin rubs against clothing or bedding, it can become damaged, particularly if the skin is moist. Shear. This occurs when two surfaces move in opposite directions, such as when a person slides down in a bed, pulling the skin and causing tissue damage beneath. Moisture. Excessive moisture from sweating or incontinence can weaken the skin, making it more susceptible to injury. Nutritional deficiencies. Poor nutrition can impair skin health and healing, increasing the risk of ulcers. Medical conditions. Conditions like diabetes, vascular diseases, or neurological disorders can affect blood flow and sensation, increasing the risk. Risk factors. Certain factors can increase the risk of developing pressure ulcers. Immobility, inability to move or change positions independently. Age. Older adults have thinner skin and may have other health conditions that increase risk. Incontinence. Urinary or fecal incontinence can cause skin irritation and increase the risk of ulcer formation. Poor nutrition. A diet lacking in essential nutrients can weaken the skin and impair healing. Chronic conditions. Conditions such as diabetes, spinal cord injuries, or advanced age increase vulnerability. Stages of pressure ulcers. Pressure ulcers are classified into 4 stages based on severity. Stage 1. Non-blanchable redness of intact skin, often over bony prominence. The skin may feel warm, cool, soft, or firm compared to adjacent tissue. Stage 2. Partial thickness skin loss involving the epidermis and/or dermis. This stage may present as a blister, abrasion, or shallow crater. Stage 3. Full thickness skin loss involving damage to or necrosis of subcutaneous tissue. This may present as a deep crater, with or without undermining of adjacent tissue. Stage 4. Full thickness skin loss with extensive destruction, tissue necrosis, or damage to muscle, bone, or supporting structures e.g., tendon or joint. Slough or scar may be present. Diagnosis. Diagnosis of pressure ulcers typically involves physical examination. Healthcare provider will examine the skin for any signs of ulcers, noting their size, stage, and location. Patient history. Understanding risk factors, mobility limitations, and any history of previous ulcers is crucial. Assessment tools. Various assessment scales, such as the Braden scale, can help evaluate risk factors and determine the need for preventive measures. Treatment. Treatment for pressure ulcers focuses on promoting healing and preventing complications. Relieving pressure. Positioning. Regularly repositioning the patient to alleviate pressure on affected areas. Using specialized mattresses or cushions can help. Turning schedule. Developing a schedule for turning patients every 2 hours or more frequently if needed. Wound care. Cleansing. Keeping the ulcer clean with appropriate solutions to remove debris and bacteria. Dressing. Using appropriate wound dressings to protect the ulcer and maintain a moist healing environment. Dressings may vary based on the ulcer stage. Nutrition. Dietary support. Ensuring adequate nutrition and hydration to promote healing. This may include protein supplements or consulting a dietitian. Infection control. Monitoring for signs of infection and administering antibiotics if necessary. Pain management. Providing medications for pain relief as needed. Surgery. In severe cases, surgical intervention may be necessary to remove necrotic tissue or reconstruct damaged skin. prevention. Preventing pressure ulcers is critical, especially in high-risk populations. Regular position changes, encouraged repositioning every 1 to 2 hours, depending on mobility levels. Skin care. Regularly inspect the skin for signs of pressure ulcers, particularly over bony areas. Keep the skin clean and moisturized. Support surfaces. Use pressure-relieving devices, such as specialized mattresses, cushions, and pads. Nutrition and hydration. Ensure a balanced diet rich in proteins, vitamins, and minerals to support skin health. Education. Educate caregivers and patients about the importance of mobility and skin care. Conclusion. Pressure ulcers are serious but preventable injuries that can have significant consequences for individuals, particularly those with limited mobility. Awareness, education, and proactive care are essential for preventing and managing these ulcers effectively. Early recognition and intervention can lead to better outcomes and improve the quality of life for affected individuals. If you or someone you know is at risk for pressure ulcers, it's important to seek guidance from healthcare professionals.